I would say perhaps the most important thing that this does not solve for is transparency. So it was also mentioned before that this process is a bit less political than Section 56. It's not necessarily in the hands of the Minister of Health. And in some ways, that's good. In other ways, it's bad because the patients and therapists, doctors at TheraPsil have had a really good friend in the Minister of Health, Patty Hajdu, and now our new Ministers of Health, Carolyn Bennett and Jean-Yves Duclos. Those ministers have been able to step up and make a compassionate decision when things are taking too long or when they're not getting passed. And it puts, a reasonable decision in the hands of a reasonable person. Sometimes it's a bit bogged down in the bureaucracy when it is bureaucrats going through a process, and it can take too long. And it may not necessarily be the best decision for that patient. Again, it's hard to say, but I call that transparency. We don't know how those decisions are being made. And what we advocate for here is that decision should be in the hands of a patient and doctor. A doctor should be acting as the gatekeeper. It's the doctor who's going to know when something like psilocybin might be a wise medical decision for a patient.